models and platform options. As we talked about before, employers are looking to private exchanges to lower costs, reduce the HR burden, and provide that better experience for employees through more choice, better consumerism, et cetera. But with over 160, as Scott said before, companies, how do you know which one? How are they different? How do you kind of go through this? Which is right for you? And so while most employers and people are really kind of understand the consultant models, there are a lot of other really interesting private exchange models that provide really good solutions for employers. So for this session, we're going to hear from 4 different vendors to better understand their value proposition for employers, brokers, and health plans. So we'll investigate the key features and capabilities of the exchanges and look into considerations for employers in evaluating private exchange solutions. So similar to the last panel, I'm going to start with Robert Steele to my left, the president of Quadrant for Health, and then we'll follow with Rob Butler, the CEO for Maestro Health. And then we have Eugene Sayin, the chairman, CEO, and president of Softleon, and Shan Fowler, director of product management for Benefit Focus. So Robert, why don't you introduce yourself?
Thank you. Well, I'm Robert Steele. Appreciate the opportunity to be here. And as we heard from a great panel last time, you have a lot of things going on within the marketplace. And as I relate it to almost the Y2K experience that those of us in the technology space kind of cut our teeth on, I see the ACA healthcare reform private exchange marketplace as the Y2K on steroids. So when you look at what's going on in the marketplace today, what we chose to do, and Quadrant 4 is a unique company. We're about 1,000 employees. We're a unique company in the fact that we have 4 verticals. We're in the healthcare space, which I do run. We have a media division. We have an education division, and we have a retail division. And so we have a group that focuses on each of those markets. What is also interesting about that, and I'll talk about that in a moment, is we call ourselves a horizontal SMAC company. SMAC being for social, mobile, analytic, and cloud. So we do like talking SMAC a lot. So the other side of that chaos is what's interesting, having been in the insurance business, I got licensed in 1976. So I've been around the industry more than I would care for anybody to know. But what's interesting about that is what we have seen in the last 35, 40 years, not much has changed from a consumer's perspective. The consumer has always fallen into what I call one of 3 categories. They're either confused, frustrated, or mad. They're confused about all the choices. They're frustrated because they don't know exactly what to do next. And the gentleman from Lock & Dunning talked about the fact that, give them 97 choices and they're going to choose the worst ones and with the poorest results. And that's not the goal of anybody. So what we tried to do when we looked at the marketplace and having built a bin admin solution back in 2000, we thought about putting a sexy front end on our benefits administration application. We chose not to do that. We chose to actually look at, we had bid 11 different public exchanges. And from that experience, we actually learned a good bit from failure. So the failure is the opportunity to begin again more successfully the next time. So we looked at everything that CMS had written, everything that HHS had written, everything that the IRS is trying to enforce, and we chose to build a brand new platform from the ground up, servicing every single constituent. So I'm here to say we are not a private exchange for a single employer. Our target market are health plans, third-party administrators, and marketing organizations that truly wants to stand up their own private exchange. We use our technology capabilities, we use our SMAC capabilities, we use another piece of technology that we've developed called Reach and Teach, and that is the ability to reach a consumer where they live and breathe on the device they know and trust with the information they need at the time they need it, and that generally is at either open enrollment, change of family status, or some other life or health event. So we are a unique company with a very robust platform. We are a web broker entity, which allows us to do both group exchange, individual exchange, and group benefits administration. And we call it a hybrid exchange. Hybrid exchange is the ability to do group ben admin, as some of the panel was talking about. Some of the large employers don't want to give up their ben admin solution. Well, you don't have to. We have very sophisticated ben admin tools for all the complex scenarios. We've been doing this a long time. And so for your FTEs, we have the ability to manage all of the complex ben admin in a very sophisticated product. But we also have the ability to do an individual exchange for your part-time, your seasonals, your retirees, your COBRAs. And that is all on one platform. With the payment gateway to do both consolidated billing and direct pay, PayPal, ACH, everything on one platform, including broker commissions and everything else that is long. That's why we focus on a very distinct market set of prospects.
Very nice. Rob.
Thank you. Maestro Health was formed with the idea that employers and employer-sponsored health wasn't going anywhere. We bet the farm that employers were going to be here to stay. We thought they'd morph. We thought they'd adjust and adapt. But we wanted to put together a solution that allowed them choice. And so we amalgamated and put together an enrollment, exchange, ben admin. They all kind of have crossover, Barbara, like you said. We also threw in our favorite piece, the self-funded solution. And people say, why would you want a self-funded solution? Which, when you're a self-funded solution, you can make fun of yourself. We call ourselves the honey boo-boo, the self-funded piece of the healthcare schematic. But when you put those pieces together, what it does, it gives the employer choice. And we didn't want to be in a situation where you actually have to sell what's in your bag. Instead, what we wanted to do was have the employer tell us what they needed, and then over time, as they morphed, we would be there. And if we service them well, we've learned that they'll give you an opportunity to use your exchange or your enrollment solution or your ben admin solution. So as a result, Maestro was formed with the idea of working through brokers and also through employers. One of the things that we've learned, and I think it's interesting, is you go out to finalist meetings or when you're going to visit a disgruntled broker or employer, and you ask them what they're disappointed in, none of them have ever said to me, well, I really didn't like the user interface or the Amazon shopping tool, or I really thought the decision support tool wasn't that cool of the previous vendor. It always ends up being a service issue. Talking to the people at Hub, we were down in their office in New Orleans, and they told us about a situation where they chose a vendor and great user interface, all those things looked great, and then when we got into the action, when we met in the middle of the field and the game started, that 834 file didn't go over as well as we thought. And so when that person showed up at the doctor's office, they didn't have the coverage. And so those are the things that we thought the market was missing when we started Maestro. And we kind of learned our lesson. We grew up in the employer health space, started in the CDH space, and we saw an interesting phenomenon with the employers that says, you know, if you got an FSA and you do a good job, we're going to let you do the HSA. And if you do a good job with that, we're going to let you do the HRA. And then if you do a good job with that, we're going to let you do more and more stuff. So the central thesis of Maestro was to be able to have all these pieces connected front and back, own all of them ourselves, because when you don't own them, you can fumble them, and you have service disruption. Go to the employer, and wherever they are on their buying cycle, be there to offer them whatever the solution they need at that time, you have it for them. We're having a lot of fun, and we're having our coming out party today, the good coming out party with Maestro Edge over there. And thanks for having us here today.
Thanks. Eugene.
Thank you. Great to be here. Softly on a little bit about maybe myself and the company itself too. We are a technology company. I would call it 14 years of failures and 2 years of success. Basically, been around and done a lot of technology implementations, and one of those projects was kind of handed over to us back in 2008, this little project called, nowadays everybody knows it as a Bromley Care, so to speak. And we were the initial technology company, put together all the back-end infrastructures of processing very different aspects of 834s, interfacing with the MMIS, with the carriers and premium billing systems and so on and so forth. Of course, we had no blueprint, nothing to follow. Kind of we invented along the way. So today, Softheon is basically focused on we have 5 disciplines, 5 principles. Our core business is our HICS integration. We use a terminology that we build a interstate highway system of exchanges. So in essence, that years of experience that we build with interfacing with systems like Facets and QNX and Amisys. So we have a domain knowledge on the back end core admin systems that are being heavily relied upon. Health plans have invested in tens of hundreds of millions of dollars building these old systems all together. So they need to have a new life, if you will. And we are able to connect these systems to any one of the, basically primarily as the state exchanges and federal exchanges. So the basic premise is there, the health plans or the organization who wants to participate in ACA, there is no need for them to build their own little highway, lack of a better term, and you can just simply ride on the Softheon highway. And of course, we're talking about, literally months, maybe no more than 2-3 months of implementation cycles, guaranteed deliverability, and then also the cost structure is nothing like a traditional IT technology. As long as you don't mind paying a little tolls on Softheon Highway on a per member per month basis, that you're able to leverage all that skills that we have put together. Last 2 years, we're already up to 50 health plans that we work with. So we've been trusted by 50 health plans as what I'll call as a wholesaler. We take their product, mainly the QHPs, also in the off-exchange space. We push those products to all the state and federal exchanges, as well as private exchanges. And on the return side, we handle all the complications around 834s. If you've seen one 834, you've seen only one 834. So every state, even in the federal FFM states, that you got pre-audit files, so you got any permutations possibly. So our job is to normalize that data. We convert it to a format that is understood by the core admin system, whatever that version that is. So we do all the intermediary work for you, translation work, so that we are able to help our plans to be able to extend and leverage all the investment they made. Our second principles in line of the HICS is tightly integrated, we call it our PayPal business, is our integrated financial management premium billing system. That also includes our regional processing centers in partnership with major FIs. We have 6 regional processing centers throughout the country. We are able to provide services, let it be lockbox services or payment processing, including phone-based, even mobile payment options to our carrier's consumer directly on their behalf. And the third unit is about direct enrollment, which is a critical component of organizations are looking to build what I call the lifestyle experience, right? If you think about the marketplace or healthcare.gov as the Expedia, the Delta.com provides a different value to that consumer, same exact consumer market altogether. So we help most of our carriers build their, quote unquote, their online presence, and with their brand, with their look and feels and whatever that might be. And then the final 2 components are tied into that will be the edge server, the analytics, the sustainability of the ACA. We also handle all the 837s and claims data submission back to CMS. And then final component is also able to bundle everything else in a small group market, especially interfacing with the brokers. So we run that all the entire gamut of platforms and technologies, empowering especially small regional health plans do not really have the capacity to a certain extent, but also the funds that are available at the levels of Blues or Aetnas and Cignas. So being able to help them out in that tough period, if you will, and being able to also take over that full responsibility, we're able to give them the confidence, we give them the scalability and sustainability. And then above all these 5 services deliver on the cloud. So we don't set foot to our customer's data center. We don't enforce them to buy any hardware or software. We work with what they have. So that's basically what's up there.
Thank you. Sharon?
Thanks. I'm Shan Fowler. I'm the Director of Marketplaces for Benefit Focus. We're headquartered in Charleston, South Carolina, also with offices in Greenville, South Carolina, Tulsa, Oklahoma, and San Francisco. We were founded in 2001. We're a 15-year-old company, and we're a technology provider, a technology platform for private exchanges, benefits administration, billing, and so on. We have 25 million consumers on our platform. We power 23 private exchanges. These are largely carrier-based exchanges. We work with 44 carriers overall. We also have a large billing business and data exchange and data integration as well. We processed, I believe it was 47 billion unique transactions last year, data transactions, so 834 is on down the line, did about $6 billion on our billing side. We have 553 large employers on our platform, and that is defined as companies with 1,000 or more employees. And then on the carrier side, as I said, about 23 private exchanges, and that also includes consultant-based exchanges.
Thank you, Shan. So similar to the last panel, you guys get to ask questions, but I will give you a few minutes to put them together, and I'll ask these guys a question that they can respond to while you're thinking. So I have to start with you, Robert. Can you talk smack and tell me a little bit about what a hybrid exchange is?
Sure. So from that hybrid exchange that I mentioned, that ability to have both a single platform to manage a group benefits administration capability for your full-time employees, and then the ability for a single employer to allow their, again, their retirees or their COBRA eligibles or their part-timers to go to the federal exchange and or a state exchange and allow that to be managed both from an administration, enrollment, and financial management standpoint, including all the change management under one platform.
What's the smack part of it?
Sorry. Okay, talking smack is about the social, mobile, analytic, and cloud. Obviously, from a social perspective, being able to allow people to use some of their credentials from various social sites, but also being able to engage consumers. I talked about the reach and teach capability earlier. That reach and teach is a significant portion of what we're developing, and that is, again, as I said earlier, that ability to reach a consumer. As we were talking, as I mentioned earlier about the confusion, frustration, and anger that exists today. It's not that consumers are not smart people, it's just not what they do every day. And one of the panelists in the previous session talked about the fact that we've got to get consumers to use these tools, to engage with these tools more than just once a year. And that's one of the things I think that are critical to a technology platform moving forward. So when you're looking at some of the social capabilities, some of the mobile capabilities, both from a consumer's perspective, mobile not only enabled, but mobile apps, as well as administrators using our capability to make sure that an 834 was sent, and if there's an error with a file, what happened and when did it happen. So we've got those capabilities, especially in the data analytics. Again, when you think about reach and teach, being able to use data analytics to really engage that consumer, because you know when they get off the train track how you can get them back on. So, and again, as mentioned earlier, it's all cloud-based. We don't have to reach in and touch anybody's system. So that's the SMAC component of what we do.
Great, thanks. Bob, self-insurance seems to be a key attribute to your exchange, but it's not for every employer. So what do you think the considerations large employers should make when considering self-insured versus fully insured?
Right. Self-insurance and the self-insured private exchange, we believe, makes a lot of sense for those employers that previously were self-insured. And initially when the exchanges came out, they were that really cool way of doing modern enrollment. And costs kind of got pushed aside. And so things like cost shifting and buying down were the way to keep costs in check. We believe that self-funding and a self-funded exchange is likely a more optimal choice for a couple of reasons. Number one, from a cost perspective, and for those employers that chose that initially, it's difficult for them sometimes to go back and go to a self-funded solution. The other key to that is, and what we really like at Maestro, and I think everyone talks about this a lot, is the data analytic component. And when you own the data yourself, you can circuitously bring it around at enrollment time when you own that data. And so instead of telling people, here's your decision support, why not say, here's your 5, 6, 7, 8 years of data. Take a look at that if you like, or if you want to, if you think things are going to change, take a look over here at this section and choose a decision support. We just finished enrolling our self-funded clients, 23,000 participants, 8,000 full-time and 15,000 part-time. And I think we had like 15 to 16 years of data for this self-funded private exchange. And enrollment took 3 months in our call center, but it was really interesting to listen to the calls. And people that actually, you can hear, and they have commonality when they know that you have that claim data. Or more than commonality, it's more of a comfort that you actually know a little bit about them. Versus, why don't you select here, then you go here, and if you have this, then you go there. So we think self-funded is really important going forward for the private exchange. But the key, as I mentioned when we kicked off Maestro, we don't want to jam that down someone. Some people are not ready for exchanges. So learn to walk before you run. And we think that with the Affordable Care Act, it was great for exchanges, but it also increased self-funded solutions as well. And that market's going downstream, and it's growing. And so we think it's a good strategy for those that have an all-in solution, go to the employer, earn their self-funded business, and when they're ready, if you've exceeded their service expectations, when it's time for them to choose a solution, you've got that all-in other piece, you'll get the first swing at the plate. And we believe employers are paternalistic. We learned a valuable lesson from a company called Extend Health. Most people have heard of Extend Health, great company. When the FASB laws changed and it was time to get the Medicare group participants off the books and into that Medicare individual plan, the employers didn't just kick them out. They chose a very, very soft landing. They went to Extend Health, and they held their hand, and they got them over the bridge. And so if you're doing a good job for the employer, when it comes time for them to adopt an exchange, allow them to morph from a self-funded to a self-funded exchange, we think makes sense.
Great. Eugene, I'm a little cloud phobic, I must admit, but what are the pros and cons of using a cloud infrastructure for a private exchange?
Sure. I think the cloud has if you look into any other industries, has been it's much more widely adapted than individuals, especially at the a lot of the social media has been driving all the initiatives altogether too. I think the biggest benefit of the cloud is about is guarantee deliverability, visibility to a very complex project like exchange integrations or being able to build the web presence and so on and so forth. Using the technology, using the best practices that were put together for working with so many different carriers, so many different large group entities all together too. You're able to kind of pick and learn, and that's really one of the big things about it. As Rob talked about it, you gotta start work before you start running altogether. So the benefit is about it outweighs it. Number one is they're unlike traditional enterprise softwares. It's pay as you go. It just feeds into the SaaS model component to it. You don't need to worry about building the infrastructure to handle the open enrollment seasons, and it just goes through this massive peaks and then go through valleys altogether. So being elasticity and then the best practices combined with the cloud technologies, it really gives you that confidence that you're looking for. The cons is, not every organization is ready to give up that. I've seen so many CIOs who are so proud of their data centers. When you walk in the organization and they take so much of a pride about what they do. Someone told me a long time ago, your biggest asset is your biggest liability. In the world of cloud, that is something that actually you can manage that very easily.
Great. So I won't be so phobic anymore. Thank you for explaining that. Sharon, what questions you have 553 large employers, I think you said. What questions should HR executives be asking private exchanges?
So I think that what we heard in the first panel about it being a tactical decision as opposed to a strategy at this point, and on down the list of these considerations. I would say that what you really want to focus in on is what is your company strategy for benefits, as opposed to what is your private exchange strategy. I think that what we've seen over the past several years, whether you call it a gold rush or a rush to judgment, or depending on the day of the week, is that you're finding that people are being asked what their private exchange strategy is. And I think, Barbara, you said there are some companies out there with very strong marketing pushes to kind of say you need this exchange or you need that exchange. And then the way that we look at it is that there are some foundational things that you should be looking at. How do you handle, what is your consumer experience? How do you handle complex eligibility requirements, because many companies have them, and especially the larger the company is, generally the more different eligibility requirements they have. What is your administrative angle? Do you handle? Do you have integrations with carriers? If so, what does it mean to have an integration with the carrier? So I think that these are kind of the kind of in the weeds question, but it all starts with what do you want to do with your benefits? How does your benefit strategy affect how you think of your employees? And from there, you get to a question of whether a private exchange is right for you or whether another method is right for you. And by the way, we don't think that the things that you're getting with a private exchange or getting off of a private exchange with a what we call a Ben admin system should be that different. It should be focused on the consumer experience and the administrative components as well.
Great. Do we have any questions in the audience? One up here? Can we get a mic? Yes, come on.
Thank you. Shannon, and for the rest of the panel, based on the groups that you have, and I think that an exchange decision, once it's been made, is terrific with decision support tools, but what are the general tools that are available to help human resources communicate the decision to migrate onto the private exchange?
It's a really great question, and I think it gets to, again, something that we've been talking about a lot today, which is year-round communication and year-round benefits, for that matter. I think that we do a lot of compartmentalizing as a industry, and I think part of that is, you follow the money, and people are only focused on what they are getting paid to focus on. But Barbara, you said the companies that you're talking to are building wellness into their culture, and I think that those kinds of decisions and really this private exchanges, if we're going to take the optimistic view on private exchanges, then we have to take a very active view on how to communicate with employees. So in the case of Benefit Focus, we have what's called the communication portal, which is a year-round communication platform or portal, along with text messaging, email messaging, those kinds of things. But what we talk to people about is that the tools are only so much. You have to have a decision. You have to have a communication strategy. And the more information you have, the more data analytics, the more that you have there, the more you can feed that decision or that communication strategy. The companies that we've seen that have done the best with both cost savings, employee engagement, consumer satisfaction, so to speak, are the ones who aren't just looking at the technology. They're fulfilling a full communication package, and we see it as our job to provide the tools in order to do that.
Thank you. Any other questions?
I wouldn't mind. May I say one thing to that question? I'm going to share, and this is no plug for anybody on this panel. I think what's happening today is, as employers are looking at kind of what's going on, they're trying to decide what to do next. Employers are about as confused and frustrated as mad, right? I think the number one thing they need to look at is what is my reasoning for doing kind of the next decision, right? And there's a tool built by Cambia, Blue Cross Blue Shield Regents, called Reform for Me. Probably the very best tool I've ever seen for an employer looking at, you're shaking your head, you know that tool? Okay, sorry. It's the best tool I've ever seen for helping for a broker or an employer understanding the financial implications of ACA. Best I've ever seen. The other thing we heard on the other panel was how to get consumers to make better decisions, and one of the tools that I've come across recently is called Healthcare Blue Book, if you're familiar with that. And again, these are not plugs for any reason other than these are tools that we research tools all the time. Those are two that I've stumbled into that I think are worth mentioning, you know, at this conference.
Thank you. Any other questions? So I have a question for you real quick, and then I'll ask the panelists a question. How many people in here are here as an employer? Okay, how about as a broker or a consultant, intermediary of other sorts? Health plan? Provider? Don't be shy. Other vendor of sorts? Excellent. Excellent. So, Rob, what role does a broker play in private exchanges if they don't have one?
Well, first of all, let me say we're biased as heck. Very subjective, because we believe we love brokers, and all our collateral will tell you that. Okay.
Fair enough.
We think that's going to morph, and I've heard things, you hear conferences, go to conferences, and people say, well, the broker's going to be like the travel agents of the world, the way the travel agency kind of morphed and went away. We believe brokers are going to recreate, and they're going to need tools, going back to communication. And so we think that brokers are going to create their own exchanges. We think that they need to have the tools to do that. And so as we looked around the market and we looked at some of the competitors and some of the people we have respect for, we thought it made a lot of sense to give brokers concierge services because they don't have enough time or enough experience like all of us, since it's a nascent market still. And so we've given them concierge services, and they need those types of services to help their employers get enrolled and get on these exchanges if it makes sense. So to answer your question concisely, I think they're going to morph. I think they're going to become as critical. And I think that what we've seen and what we hope that we continue to see is that brokers who used to say, you know, I'm not giving up any of my pie. This is my pie. I think they're now saying, okay, you know what, I don't mind partnering. If you can give me that technology, if you can let me have that for free, or you can give me some services, whether it be concierge, or you can give me my own private personal exchange that I can use, I'm happy to share in some of the revenue streams. And so we've had a lot of luck lately, and we've seen a lot of our competitors do a good job with that as well. So we think brokers are not going anywhere. Like anything, they're going to morph, and they'll get better at it.
Yeah, I think there's more pie in the exchange world for them.
We like bigger pie.
I like bigger pie, bigger pie. Eugene, what criteria do you think that health plans should use to develop a long-term strategy around exchanges? Whether they offer their own or play on others or both?
Absolutely. I think if the overall theme is a consumerization or a consumer-driven healthcare delivery and services model, if you look into any other industries, a consumer-driven model, the industry itself has to transform itself into what I call a supply chain management. So there's a lot of demand side in here. I can see there's a lot of brokers and health plans, or even the individual the groups and whatnot too. I think the key thing is going to be about creating that wholesaler mentality. That as a health plan on the supply side, basically what you do want to do is consider this as an exchange as a holistic and business model. Really, it's not just a private versus public or whatever that might be in between. If you look at that holistically, what you do need to do is again, do you really want to push your product, open up your own little retail store? Perhaps you may, following Apple's done a great job about reinventing that business model. But you can also buy iPhone at Best Buy. I mean, you can go to the nearest, where the competition is on the price element altogether too. So I think both on the supply side and the demand side, the importance of the middleware is going to be key thing to it. We've recently been deemed as a web-based entity, for instance. Now we have, our platform has 80,000 products. So if I may make another generalized statement, if the healthcare.gov is the Costco, where so many products on the shelves and pile them all together, and this is why it's so important to be able to maintain also the relationship and technology and everything else you can provide. So you're able to basically channel the consumer to the right place at the right time. And to that note, the brokers will play a critical role. The way we see the brokers, kind of little kiosks that you see on the Costco's, if you will, they draw that consumer to that one specific product, and they play a critical role. So we believe that combined with the technology, the transformation to the supply chain model, if you will, that I as a health plan, I don't want to deal with so many different private exchanges or public exchanges. I want to be able to ship my product to my wholesaler, let that company push my product to so many different business partners or retailers that I'm building. And that's what we think, that's at the cusp of we're seeing that kind of the demand on the technology side. Unfortunately, what they've invested on the supply side for the last 15, 20 years, health plans have been quite reluctant to create that kind of a holistic business model, if you will. It's been very much a basically one-stop shop, whether it be Medicare or Medicaid side of the business, or even the commercial business models. And so this is what we think that it's exciting about us.
Audience questions? Any hands?
I'd like to, if there are no audience questions, I'd love to address that.
Want to jump on that one?
Yeah. So I think that when you look at it, we are very early on, and there's little to no true retail competition happening, even in the private exchange space these days. It's still essentially business as usual. The brokers are, picking a health plan on behalf of their clients. That's then the health plan that is in the private exchange. And that has to do with the ASO arrangements and the sort of whatever the threshold is, the 75% threshold or whatever that carriers say that they can't operate in a self-insured model without, or even in a fully insured model without that sort of guarantee of business. So you're seeing that there is a lot of direction happening, and the competition is really happening at that broker level or the traditional, where it's always been happening, and that they're kind of driving costs. There are some, fully insured marketplaces that are changing that up a little bit. And in the individual space, that's where things are really getting pushed and could eventually push the group spaces into something that's much more real competitive. I think that another thing that's happening in the broker market, and what we've seen from some of the data on our platform, is that we've actually seen where brokers have taken on a greater role than they did before, especially in the individual market. There was a great story on NPR about here in Texas, the lack of navigators and those kinds of resources in the individual market. There's been a real kind of, again, retail, like get in your Honda Civic and drive around and enroll people type of attitude amongst in the individual broker market to get people on board because they don't have any information to do it. So in those cases, brokers are becoming not even just valuable, but even more valuable than they have before. And on the flip side, I think that there are some things that are happening that I would caution against, and that has to do with sort of trying to legislate competition from other areas out of the equation. And I'm thinking about things that are happening with Zenefits and what happened in Utah, where they're trying to force them out of business or force them not to do business in the state. And it's not just unique to the healthcare space or the broker space in our industry. It's happening with Uber, it's happening with Tesla and the way that they're selling. And ultimately, that is a losing cause. It's going to be a losing cause. So I think that the role of the broker, just as with everything else in this industry, there's an atomization, and we don't know. This is something that one of the CEOs of a carrier told us one time. There's an atomization that's happening in the market right now. And when everything comes back together, it's not going to be the same thing that it was before. And we need to be conscious of this disruption and know that we're not at the end state now, but that we need to be, ultimately keeping an eye on the fundamentals are the things that are going to get you to the next stage, as opposed to protecting your net, so to speak.
I have a question over here.
Maybe taking off a little bit of, Shannon, what you started to discuss, are there any legislative, regulatory, legal issues on the horizon that would either help or hinder the growth of exchanges?
Well, I think that certainly there are plenty. I think starting off with the fact that we're the basis for much of the defined contribution conversation and how people are using it is based on the 40-year-old cafeteria plan models and so forth. That's an issue. Of course, there's King versus Burwell, and what could happen there. There was something that was recently put forward in and didn't really go anywhere. I think it was in the last legislative session that essentially said that, or it was a legislator, a representative from Louisiana, I believe, who was trying to get tax deferred status or tax preference for individual coverage for small groups. So there are a lot of, there's a ton of activity here. I don't think that you've seen the end of it. I think another huge thing going back to this ecosystem and thinking holistically about what benefits means, telemedicine is, it's not considered real medicine in some states, and I think, or real medical care. And so I think these kinds of things are hindrances to this future, this optimistic future that Barbara talked about in the last panel.
Any other questions? Do we have a question back there?
So I see this as a revolution, not an evolution. And in all revolutions, there's blood. And I'd like to know, as your technology right now is connecting to health plans, do you see the possibility of disintermediating contracts with doctors and hospitals and breaking the black box and having direct contracts, financial contracts per exchange outside of an insured contract, outside of an insured arrangement? I guess you know what I'm saying.
Robert, you want to start with that?
Let me make sure I understood the question. What you're asking is, do you see us as a technology partner creating a direct relationship to a provider, like a provider-sponsored health plan, an ACO, or something like that? Is that correct?
That's correct.
I do see that coming. We're in conversations today with some companies that want to stand up a provider-sponsored health plan. And as such, being able to provide that technology infrastructure to do that. So we are in conversation to do that. There are certainly ACOs that are out there that are trying to do things differently than they were yesterday. Obviously, you've heard several conversations around bending the cost curve. Today, we're not bending the cost curve. And until we get to that and a more engaged consumer, we're not going to see that cost curve bent to the level that we need to. You also have the co-ops that are out there, whether there are 22 co-ops left, one just filed bankruptcy. There's a couple in the country that are actually doing okay, but Congress is not giving any more money for another co-op. They're basically now just baby health plans that are trying to figure out what they want to be when they grow up. And so you got literally a mom and pop organization that was stood up with a bunch of government money and are now trying to figure out what they are going to be when they grow up. And there's going to be a significant amount of change that goes on there. So again, to the conversation Shan said was about the regulatory environment, I think healthcare, as we know it today, is like that stretched rubber band that is right before the position of breaking. It's never going back to what it was. So from that chaotic state, we got to figure out how to adapt to that. And I think you're going to see that adaptation with other type of distribution systems. And I do believe there's a role for the brokers. Having been a broker, I'm a COU CHFC. I'm also being an ex-jock educated far beyond my intelligence. But at the end of the day, that is what we're going to see. So that's the world as I see it.
There's a company we're working with behind the scenes as their back engine that is trying to recreate. Anyone know Oscar? You know, we're trying to create that in Texas. And he's calling it a new and improved Oscar, whatever his marketing hype is. But he's trying to create this narrow network. He's going to leverage reference-based pricing, for those who know what that is. And some people look at that as evil, some like it. There are certain companies out there that take an aggressive, egregious approach, and there's those that take a more modest approach. But we see that in that self-funded side as far as being able to offer the narrow networks. But there are some startups in Texas that are going to go to some very narrow hospital and doctor networks to offer a Oscar on steroids, whatever his marketing hype ends up being.
Yeah, I've been working with a couple of physicians that are very interested in this direct contracting with employers and using exchanges as a way to do it. Shannon, you're seeing the same thing?
Yeah, we've seen a lot of, we've seen a great uptick in interest in, like, you know, ACOs and, you know, the Oscar model and so forth. It's such a, well, from the current state, it's, you know, such a different model that it really, you know, it really could shake things up. And I think it's going to take a while to get there. But if, you know, I mean, it all comes down, if they can prove that it's better for their employees, it's better for their bottom line, then ultimately, you know, you could really see a huge uptick there. Yeah.
When the changes happen, I mean, if you look into the co-op, we work we're probably about 30% of the co-op market, to be honest with you. They are in such a survival mode. They are definitely thinking out of the box because they have to, you know, beyond it, their sustainability, their future is always being questioned. And also, if you look into the integrated healthcare systems, there are being, you know, they need to find different ways that with all the readmission penalties and whatnot. And the industry is changing. I mean, if you're not making somebody upset, you're not doing your job anyway in a disruptive, in a transformation, right? So it's already happening. There are great examples out there too, whether it be Oscars or the co-op-based integrated systems like North Shore LIJs and Northeast doing a great job about converting themselves into the, you know, this entity very much like modeling or Anglo-Indian Kaiser model. So I think that in the conversation, I think there's going to be new JetBlues in Southwest, and there are going to be some Pan Ams. So this is what the industry is going through right now.
Great. Any other questions? We have another one?
I was just wondering if each of you could touch on a little bit more about your billing solutions. You know, once a consumer has elected a benefit or enrolled, you know, what's the experience from that perspective?
I'll start out if you don't mind. And say that,
By all means. We'll finish them up.
We were able to land a person from Aetna as part of our product marketing team or our product team. She actually leads product. And when I was talking to her, she said, you know, if you really wanted to fix things in healthcare, you could figure out a way to do a better job of billing. No one does a great job of billing and amalgamating all the different carriers and getting one bill for the employer to actually understand, and it gets into the EOB. And so what I would tell you is I believe that is going to be a real critical lever going forward. If I'm an employer, I'm going to say, show me your billing solution, tell me who does it. I don't want it outsourced if you don't have to. If you do outsource it, I want to see them. And I want to see what this bill is going to look like. Because at the end of the day, we've seen that be kind of one of these. And you talk about service disruption, we think it's a big advantage for those that have a billing component as part of their exchange enrollment solution. So I can't see your face because of, you know, don't look at the light, but I think that's a great snip on your part, whoever that is that asked that question.
There's a real consolidation, or there's a real, it goes back to that compartmentalization as well. You know, we think of it, or certain components think of it as, I just need to get my money. But from the you know, employer's perspective, they want to make it as smooth as possible. And then you get into individual, you know, going beyond payroll deduction, and there's some, you know, it's all fine and dandy to say they can pay with a credit card, but many carriers have such small margins that if they take a credit card, it just destroys any sort of margin that they have. So you have to sort of think differently in that regard as well.
And the consumers are really demanding a lot. Just now, because they have transition from this, typical, my employer covers them up, I just go up there, pay my copay, I don't worry about everything else. So every fulfillment entity, let it be invoice, or welcome kits, or ID cards, electronic portal interfaces, whatever that might be, it is a touch point. It's about way to connect with the consumers. So you want that invoice to be really nice and clean and understandable, not full of jargons like an EOBs has been a big nightmare in the industry, always a bad reputation. So you want to be able to use that, and then most importantly, the technology has to be fully integrated, because the moment they make a payment on the portal, they want to be able to see that reflected in their online statement the very next minute or day, or even sometimes in the next minute or seconds. So without that total integrations and disparate systems and silo approach is not going to be something that consumers are going to be looking favorably.
Any other questions? Couple more. Robert, along the billing lines, kind of a little bit anyhow, what's the payment gateway and how does that work for both payroll deduction and then direct pay?
So following up what Eugene was talking about, when you look at the billing and reconciliation, the only invoice from whether it be a health plan or an insurance company, the only invoice that is close to being correct is the first one, right? Everything thereafter is a manual reconciliation on both sides, twice. It's painful, and that should be eliminated. And so, again, all of these gentlemen basically do similar things in the fact that what you're trying to do is to eliminate manual reconciliation, and you do that with a very solid enrollment system, great data integration, and the tools necessary to connect those dots. That's critical. Having the ability to do payment gateway from an individual standpoint, and even being able to handle where you can actually go to an ACH transaction when there's not enough money from a part-time or full-time employee that doesn't have enough money to pay the entire premium, to do that on an ACH in a combined fashion on the same platform is something that's very, very critical going forward. And so that's part of the payment gateway that we have developed, as well as for our clients being able to manage the broker commissions and everything else. So it is a fully integrated financial management platform.
Gene, one more question for you that really has to do with the health plan side as well. What are the hidden risks that organizations should avoid when building and operating exchanges?
There are some really, we don't even have to think hypothetical in many of the cases. I'll give you one example. The health plans, we had about 3 or 4 health plans in Oregon. So last year, middle of the year, basically the state said, we're shutting down our exchange. You guys are going to move to the federal exchange. Okay? Similar type of predicament may happen any minute, depending upon the Supreme Court decisions. If the plans now being pushed to go to state exchanges. Health plans are not that agile, with all due respect. The technology, again, in place, even on any scale. So the sustainability is a very important thing. Technology has to be in a very holistic way that can be, again, being able to integrate with so many different exchanges. And so by definition of an exchange, you need to be able to move the data back and forth from so many disparate systems without needing to worry about that, well, this exchange gives me this data in this format and so on and so forth. So on the top of it all, the consumer aspect, it's not something that really the health plans are comfortable with. And I think that if you combine them all these little challenges, the barrier of entry to the exchanges, and it's one of the reasons, even after 2 years, right, there's only about 300 or some health plans in the ACA marketplaces versus could have been expected to be much higher numbers. So all these barriers are being basically looked upon in the eyes of the CIOs and COs and CFOs. I've spoken to so many C-level executives, basically they say, look, we don't know. We don't want to invest so much into it. And then other aspect to it is they view exchanges as a way to cannibalizing their existing business models. So there are this very conflicting personality, if you will. And if you're on top of it, if you start talking about the turf and domains that are being established within the organizations, and kind of there's a pull and push mentality. There's so many dynamics, so many elements moves into that stuff.
May I add one thing to that? Gene, you're 100% correct. The health plans are facing such a huge challenge today with the 80-20 provision of ACA. Think about the fact that you're now being legislated that you can't really do a great job in serving your clients and controlling costs because you then have to give it back to your client, right? Think about the fact that now 20%, if you think about a health plan, what's their largest expense? Their people. Second largest expense might be their benefit costs of their own. The third is going to be IT. And Eugene, to your point, they're unwieldy in many cases. A Blue in the Southeast just laid off 1,000 people, has to cut out $250 million in overhead just to come into compliance with ACA. These are problems that most of us aren't facing today. These are huge problems. And so these health plans are having to adapt to a different way of life. And so while this is not on the subject of ACA or of exchanges per se, it is because the health plans are adapting to a different world that we're living in. That's the chaotic state that I mentioned earlier. It's a crazy world out there. And I do think that we are very immature. I think, Eugene, you mentioned a walking stage. We're in a crawl, walk, run world. We're still crawling, from an exchange perspective. And it's going to take some time to mature for all of us.
We have time for one more quick question. I can ask it or you can ask it. Okay, real quick to the panel, starting with you, Shan. Are private exchanges really a vehicle for long-term savings?
I think that so I would prefer. Right? You mentioned.
Don't throw it here.
Don't put that.
So you mentioned the Y2K. This is like our Y2K, and I want to use a slightly different turn of the century analogy. And that's the .com boom. So I was in San Francisco. I was the young urban professional with my Muni card and working at .coms, and what happened was that the rhetoric far outpaced the real solutions. And that was a real lesson, like a huge life lesson in terms of the way things work. So when the question comes up, are we going to save money with private exchanges, what I go back to is, should we even be having the conversations about private exchanges, or should it be something else? I was talking to a friend and trying to explain what it was I did, and I told him about private exchanges, and he said, well, that sounds like something that would happen in a hotel, and you might get arrested for it, So we're not great.
What do you do?
We're not great marketers. We're not as good at marketers as we are analysts and all of the rest in terms of the complexity of our business. So will private exchanges save us money? I think that the sum total of what is happening right now will have a positive impact on costs. But I think it gets back to what you're saying in terms of the optimism and thinking of everything holistically, and not just focusing on health, or not just focusing on private exchanges per se, but really focusing on strategically what we want to do. So Doug was saying, I mentioned this last time about a flashpoint, and I think the thing about flashpoints is that we can't always predict them. They do come. We're usually wrong about what they are and when they are. I don't think we've seen it yet. All we can do is be as prepared as we can and do everything we can as technology providers to help drive the costs for.
Anybody else want to jump in?
I think really is that private exchanges I don't want to call it in private or public again. I think the whole exchange business model is it's a change. So from this point forward, I think what we're going to see is that change is the only constant element, and there's going to be constant turns, ups and downs altogether. And as an industry, all the way from the consumer to the supplier and the demand portion of it, I think there's going to be a lot of interesting things to just wait to be seen, and we don't even know what they are yet.
Exchanges are a tactic, not a strategy. And if you don't have one, you're not cool. Because the CFO or the CEO is going to come down and say, hey, when are we going to get us one of those things? And why don't we have one of those? It's kind of like the debit card. When the debit card first came out, remember when the TPAs got them? The employers wanted them, but the TPAs that had them didn't want to give them away because they didn't know how they worked, and it cost them money. But the demand created or drove the TPAs to get better at it so they could start making money at it. So what I would tell you is an exchange is really a cool way of shopping for your health care. Eventually it'll catch up, the technology will catch up, and we'll figure out how to save money and drive costs in various ways. So it's just a cooler way, and it's a good step in the right direction the way we view it. It's not the end all though, and it's not for everybody yet.
I think it's the vehicle.
Great. Thank you very much. Thank you for your time.